Have you ever wondered about the role oral hygiene plays in a hospital setting? It's a question that doesn't often come up, isn't it? When we think about hygiene in hospitals, our minds typically go to hand washing, sterilization of equipment, and clean linens. But oral hygiene? It's a topic that doesn't often get the attention it deserves. Yet consider this. Our mouths are a complex ecosystem of bacteria, both good and bad. And in a hospital setting, where patients may have compromised immune systems, maintaining a healthy oral environment is critical. It's not just about fresh breath or avoiding cavities, it's about preventing the spread of harmful bacteria that could lead to serious infections. So, while it might seem like a minor detail in the grand scheme of hospital hygiene practices, oral care is actually of paramount importance. It's a crucial line of defense in protecting patients from potential health risks. But what if I told you that something as simple as toothbrushing could significantly reduce infections and even death in hospitals? A recent study published on Medscape delved into this very topic. The goal of the research was to explore the impact of regular toothbrushing in a hospital setting on rates of infection and mortality. This isn't a topic that's widely discussed, but it's an area that has the potential to make a significant difference. The researchers embarked on this journey with a clear aim: to determine whether something as simple as brushing teeth could reduce the incidence of infections in hospitalized patients and ultimately save lives. They focused particularly on patients who were already at high risk of infections, those with compromised immune systems, the elderly, or those with long-term hospitalization. The methodology of the study was meticulously designed. The researchers divided the participating patients into two groups. The first group was asked to follow their regular oral hygiene routine, while the second group was given a more structured regimen, which included toothbrushing at least twice daily under the supervision of hospital staff. This approach enabled the researchers to compare the outcomes of two different oral hygiene practices in the same hospital environment. They collected data on the number of infections and deaths in each group over a specified period. The study was thorough, taking into account various factors that could influence the results. Variables such as age, overall health status, length of hospital stay, and the type of illness were all considered in the analysis. The researchers also ensured that the study was as unbiased as possible. They didn't reveal to the patients or their caregivers which group they were in, a practice known as blinding. This was done to ensure that the results were entirely due to the differences in oral hygiene practices and not influenced by any preconceived notions or biases. Now that we understand what the study intended and how it was conducted, let's delve into what it found. The results of this study may surprise you. Now let's dive into the details of these intriguing findings. The research was primarily focused on understanding the impact of toothbrushing in hospitals. The hypothesis was simple. Could maintaining oral hygiene in hospitals potentially reduce infections and consequently decrease mortality rates? The answer, it turns out, is a resounding yes. But the extent of the impact is the real eye-opener. The study found that regular toothbrushing in hospitals significantly reduced the rate of infections. Now, these weren't just common colds we're talking about. The reduction was noted in serious, life-threatening infections such as pneumonia, which is often a silent killer in hospital settings. The reduction in infection rates was not a mere few percentage points. It was substantial, a striking revelation that underscores the power of something as simple as toothbrushing. But the findings didn't just stop there. Along with a decrease in infections, the study also observed a concurrent reduction in mortality rates. Fewer infections meant fewer complications, and fewer complications led to a lesser number of deaths. A simple act of brushing teeth seemed to set off a positive domino effect, cascading through the patient's recovery process. The percentage reduction in mortality rates was significant enough to warrant immediate attention. It wasn't a small statistical blip that could be brushed off as an anomaly. The study found that this simple act of toothbrushing could potentially save lives, and not just a handful, but a considerable number. These findings are not just numbers on a page, they represent real people, real lives that could be saved. They highlight the power of seemingly mundane acts and their potential to bring about change. But what does this mean for hospitals and healthcare professionals? The implications are vast. If something as simple as toothbrushing can have such a profound impact, it opens up a whole new avenue of preventive healthcare measures. It underscores the importance of oral hygiene in overall health, a fact that is often overlooked in the hustle and bustle of hospital life. But let's not forget, every study has its limitations. The research focused on hospitals, but the impact of toothbrushing in other healthcare settings, like rehabilitation centers or long-term care facilities, remains to be seen. Further research is needed to understand the full breadth of the toothbrush's power. These results have far-reaching implications for healthcare practices, don't they? Let's explore those next. The implications of this study reach far beyond just brushing your teeth. In fact, they extend into the very heart of hospital hygiene practices, challenging us to rethink our approach. We all know that maintaining oral hygiene is crucial, but this study suggests that it might be even more important in a hospital setting. Imagine a world where every hospital integrates toothbrushing into their routine care practices. It could revolutionize the way we approach patient care, leading to improved outcomes and a significant reduction in hospital-acquired infections. Consider the potential cost savings. The cost of a toothbrush and toothpaste is minimal, especially when compared to the expense of treating a hospital-acquired infection. Hospitals could save thousands, if not millions, by introducing this simple practice into their daily routine. And let's not forget about the patients. Improved oral hygiene could lead to a decrease in infection rates, reducing the length of hospital stays, and improving overall patient experience. Patients would not only recover faster, but they would also feel more cared for, knowing that their oral health is being given the attention it deserves. This study also has significant implications for public health. If adopted widely, this practice could potentially reduce the overall burden of disease, leading to healthier populations and less strain on our healthcare systems. But it's not just about the physical health benefits. There's also a psychological element. Incorporating toothbrushing into hospital routines could help patients feel more at home, providing a small sense of normalcy in an otherwise unfamiliar environment. This study truly challenges our understanding of hospital hygiene practices, doesn't it? But let's summarize what we've learned so far. So, what did this study teach us about toothbrushing in hospitals? Well, quite a lot actually. It underscored the critical role that oral hygiene plays in a hospital setting. We learned that maintaining good oral health isn't just about preventing cavities or gum disease. It's a significant player in controlling infections and reducing the rate of mortality in hospitals. The study provided us with substantial findings. It highlighted a direct correlation between regular toothbrushing and a decrease in hospital-acquired infections. The patients who participated in regular toothbrushing had fewer cases of pneumonia, and the overall rate of death was significantly lower. This is a clear testament to the power of something as simple as brushing your teeth. But the study's implications extend beyond the brush and the paste. It's a wake-up call to healthcare professionals and institutions alike. It's a reminder that the little things matter, that they can have a big impact. It's a call to integrate and prioritize oral hygiene into the daily care routine of every patient. It's about fostering a culture that values toothbrushing as a non-negotiable part of patient care. The study also serves as a stepping stone, a foundation for future research. It invites us to delve deeper, to uncover more about the intriguing link between oral health and overall health. It beckons us to explore how we can further leverage oral hygiene to enhance patient care and outcomes. In conclusion, the study paints a vivid picture of how a simple act of toothbrushing can make a world of difference in a hospital setting. It's about more than just a clean mouth. It's about healthier patients, fewer infections, and ultimately, saving lives. Remember, something as simple as oral hygiene could make a significant difference in a hospital setting. So keep brushing.